Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about von Willebrand disease. Von Willebrand disease is a most commonly inherited hemostatic disorder. Mainly, it is an autosomal dominant disorder. Von Willebrand disease is a blood disorder which is most commonly inherited hemostatic disorder which is autosomally dominant. It occurs due to qualitative or quantitative defect in von Willebrand factor. When there is any qualitative or a quantitative reduction of von Willebrand, this causes von Willebrand diseases. Generally, what is von Willebrand factor? It is a multimeric plasma glycoprotein. It is a plasma glycoprotein which is synthesized by two things, which is megakaryocyte as well as endothelial cell. It serves two major functions. The von Willebrand factor's functions are: it acts as carrier protein for factor VIII. It carries the factor VIII protein, or von Willebrand factors helps in adhesion of the platelets to the subepithelial collagen. It helps in adhesion of the platelets also, as well as it carry factor VIII, clotting factor number 8. These are the two major function of this von Willebrand factor. First one is, it is an inherited hemostatic disorder which is an autosomal dominant disorder. This disease, von Willebrand disease, comes due to qualitative or quantitative defect in von Willebrand factor. The von Willebrand factor, what is von Willebrand factor? It is a plasma glycoprotein, multimeric plasma glycoprotein, which is synthesized by this von Willebrand factor is synthesized by megakaryocytes as well as the endothelial cell. This is the introduction of this von Willebrand diseases as well as the factor. The clinical feature of this disease, von Willebrand disease, is epistaxis. There will be bleeding in the nose, inside the nose, bleeding, menorrhagia, superficial varices as well are present. These are the clinical features. In gastrointestinal GIT, there is bleeding may be present. Excessive hemorrhage may be also observed after the dental extraction or surgery. After extraction or surgery, there will be more bleeding occurs. This is the clinical feature of this von Willebrand factor. The investigation of this are prolonged bleeding time. There will be prolonged bleeding time seen. Normal platelet count, reduced VFF, which is von Willebrand factor plasma level, and reduced factor VIII. Due to when there is reduced von Willebrand factor, it does not helps in the carrying of the factor VIII. So here, when it is von Willebrand factor plasma level is directly proportional to the factor VIII activity. So if von Willebrand factor decreases, the factor VIII is also decreases. Due to the von Willebrand factor only carries the factor VIII. There is increased bleeding time is seen. Reduced adhesion activity of von Willebrand as measured by the cofactor. The major two function of this, one of the major function of the von Willebrand factor is adhesion of the collagen fiber platelets into the subepithelium. So that activity is also inhibited. The treatment are cryoprecipitation transfusion is done. Factor VIII and factor von Willebrand factors are in the concentrated level is given to the patient. Desmopressin is given and antifibrotic agents are given. These are the treatment of this von Willebrand factor. Thank you. If you like this video, please like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. Thank you.